Growing up, I'd always been taught homeless people, they're called bums, they're lazy, they don't work, they don't do this, they use drugs, they drink, and here I am, I don't do any of those things, and I'm homeless. You know, there's so many different things that could lead to someone becoming homeless.
One of the things that we talk about a lot in the community is how many people are one paycheck away from being homeless, one wrong decision away from being homeless.
Everybody's a step away from being homeless. All of us, So, yeah, I look at it like this could be me. And how do I want to be treated?
H3 stands for Health, Housing, and Homeless Services. We are a program of the Health Services Department that really focuses on connecting individuals who are experiencing homelessness in our community to the housing and supports that they need as a pathway to better health. Our goal simply is to make homelessness an uncommon occurrence in Contra Costa County. And we do that through a network of providers, community-based organizations throughout Contra Costa that are really working together to create the safety net. In addition to that, H3 also provides our own continuum of services. We have 4 shelters in our community, including one that specifically serves transition-age youth who are experiencing homelessness between the ages of 18 to 24, as well as a respite shelter, which is really focused on individuals who are medically fragile. We're the only provider of outreach services in our community. Our coordinated outreach, referral, and engagement teams, also known as CORE, provide mobile in-the-field services for individuals in our community.
From the moment I clock on at 9 o'clock till the moment I clock out, it's go, go, go. There'll be days where we'll have 20 people that we're seeing back to back to back all day long. And then there'll be days where we've even spent time with one person all day long. It just depends on what their need is at that time.
We're working with the most vulnerable and broken population. A lot of the people have lost their hope, they've lost trust in society. So upon first engagement, they may really not want to talk to us as well. So once we build that trust, let them know that we will be back or that we can help them, we make sure that we follow up with our word.
We hand out blankets and food and survival supplies, things like that. Socks, a lot of socks.
We may take them to a local shelter, a care center, a warming center, somewhere where they can get a shower, a hot meal, take them to a doctor's appointment, provide transportation for them, or just take them to get some food to build that relationship. From there, we try not to give up on them. If we do take them to a shelter, we try to check on them and let them know that we're still there in case they need us, and try to walk them through the steps.
One of the largest programs that we operate is permanent supportive housing. We have 600 units of housing throughout the community here in Contra Costa, where we are placing individuals in housing and then providing them necessary supports.
Once they get into my program, my role as case manager is to meet with them weekly. And what we work on is getting them used to being housed. And that component means like paying your rent on time, being a good neighbor, following the lease agreements and the program agreements.
Well, they've definitely been a big help, just moral support and also physical support. I mean, before that, I really didn't know where things were going. I knew I wouldn't survive very good on the streets. Greg's been fantastic. He's always been a really good support system, someone I can call up and get advice from or anything like that. The program's been fantastic. I don't know if I want to say that I couldn't have done it without them, but it would have definitely been a lot harder road without them.
I have always sort of worked with the notion that it is simply my duty as a human being to support other human beings in really achieving their idea of their best self. And for those individuals who need an extra helping hand, that's what I am here for. And I am extremely proud of the team that has been put together to support those individuals in their most perhaps horrific moments of their life.
We're here because everyone deserves basic comfort, deserves to be housed, not to have to worry about where their next meal's coming from, things like that. And we just want people to know that there's people out there that care.
Watching hope being restored to people is what keeps me coming back. When you really get to see somebody who has lost complete hope, somebody who is down and out, and someone who didn't have the ability to make it on their own, and you get to partner with them and see the lights turn on for them and see them get their keys to their apartment, it's life-changing for you because it restores hope in society and it restores hope into people that have lost it. It's the main reason why I keep coming back.